Dr. Jennifer Berman, urologist and internationally renowned expert and pioneer in the field of female urology and sexual medicine. As a leading expert on women's sexual health, she appears frequently on national television and radio. She is quoted in numerous publications and is co-author of 2 best-selling books.
We are talking to doctors Jennifer and Laura Berman about breakthrough treatments for the millions of women who suffer from sexual dissatisfaction.
Well, it's actually one of the first lines of therapy that we do, and for a woman to know exactly what it feels like to have an orgasm or exactly what it feels like when her body is aroused, women, they don't know what to do. They need to be taught. I mean, we don't come with a book that says, you know, touch here, point there.
Here with tips on how to improve your love life is sexual health expert Dr. Jennifer Berman. Hi, Jennifer. How do they start getting on the same page?
I think a lot of what needs to be done and what could open their sexual secrets is communication. I think both couples love each other and are connected to each other, but are not always on the same page.
How do you tell your partner you're bored without saying, I'm bored?
With the sex?
Yeah.
That's a good question, too, and we're all confronted with that novelty is really important. And what I would say to do is do that outside of the bedroom. Tell him you really praise what he does do right and what you do like, and talk about exploring fantasies.
Jennifer, we want to ask you right away, though, what exactly is human growth hormone, briefly?
Well, growth hormone is a hormone that's secreted in the brain. It is similar to estrogen, testosterone, progesterone. Human growth hormone declines as we age.
Get over it, sex sells. And whether a man does it or a woman does it, the issues related to sexuality, the women having ulterior motives or using it, there's something sleazy or cheesy or slutty about that. The bottom line is women can use their sexuality, and what I was saying about feeling empowered and entitled, us needing to feel like chastised and stagnant and asexual is wrong.
Is there a downside? I mean, they seem to have fundamentally changed relationships and behaviors in some way.
Well, I think the downside would be if people put unrealistic expectations on themselves, where women feel like they need to be swinging from the chandeliers, or men feel like they have to have a marathon 24-hour erection or something along those lines. The point is that there is help if dysfunction exists, but our expectations need to be realistic.
Started out, this was a serious medical device for pain.
It is direct sacral nerve root stimulation, and the device is FDA approved for bladder problems and pain. And what Dr. Malloy anecdotally found, and that what we have found in people that use the device, is they're recording enhanced sensation, sexual sensations.
Let's start with that first question, sex during pregnancy.
Sex during pregnancy is actually advocated not only from the standpoint of bringing intimacy between the couple, but actually if everything is okay with the pregnancy, in the later months, it actually can induce labor.
Is that really doable?
There does have to be chemistry, and if it doesn't click on either end, then he needs to move on to candidate number 2. Kissing is a fundamental part of intimacy and actually can often initiate a sexual act. And what it does is, because of all the nerves in our mouths and on our lips, it can enhance or promote sexual response. Our how-to show continues in just a moment with a lesson now in touching. You won't want to miss it when Berman & Berman comes right back. Welcome back. We're talking about sexual signals. Let's see what happens once you're in a relationship and then you move in together. The sexual signals don't stop, do they go unnoticed? Physiological relations can be impacted by emotional pressure for women to play for orgasm. It's good to have you both with us. I mean, I remember we are beginning to realize it's the same medical problem.